Hi there and welcome to our first mini episode of Experience-Based Mom. I'm Alyssa Loftus, also known as Medicine Mommy. I'm a mom of two very busy little boys and a medical doctor.
Hi, I'm Nické Theron. I'm a pediatrician and currently stay-at-home mom of a 2.5-year-old boy and a little girl soon on the way. I have a blog called Pediatrics and Play-Doh.
So we both love encouraging and empowering moms with the latest up-to-date medical information and to equip other moms. And obviously coronavirus is such a hot topic at the moment. So we thought that we would get together to share some valuable general tips with you and also what the latest information is on coronavirus and pregnancy and also breastfeeding and the risks involved for kids. So firstly, let's jump right in. I would really like to encourage you all to stay calm as far as you can. I know it's difficult with all of the hype. And you know, when you get to the supermarkets, the shelves are quite empty, and I know, it's crazy. And also the media that is also constantly, giving you the updates of the latest number of cases that have been specified, and tested positive. So yeah, I think it's very important to stay calm. And stockpiling is definitely not the solution, please. So let's talk about things that you actually can do and that would add value. I think the first thing is just general proper hygiene. So hand hygiene, washing your hands at least for 20 seconds, and then cough etiquette. So if you do cough or if you have a cough, please cough in a tissue and discard the tissue, wash your hands afterwards, and or if you don't have a tissue, cough in your elbow. And so I think that is very important. And then hand sanitize when you can. And then obviously a proper, well-balanced diet for your kids. But if you have picky eaters like I do at the moment, a toddler of 3, so then you can supplement your kidney with some extra vitamins. I just use gummy vines and extra zinc fix at the moment. So I think that's important. And I think the most important tip for today would be social distancing. So unfortunately, we need to cancel those parties and shopping expeditions and so on. So the kids' parties.
Yes, but maybe you can celebrate a year and a half.
Yeah,
instead of half years. Do something fun like that.
Yeah.
Do something fun on the day. Luckily, nature is still open.
Exactly. Let us focus on what can we do and not what we can't do.
Yeah.
So like you said, nature is always open and available. So do some gardening with your kids and some arts and crafts. And baking. Yeah, and baking. I love baking and eating.
Yes, definitely.
So let's focus on the positives and see this time as a time where we can really maybe reconnect with our families. So I think that's And do you want to
remember the littles look up to you.
Oh, absolutely. So that's also a reason why you need to, set an example for them because they really watch you and they listen to your words. So just be careful of what you say, that you don't spread more fear and uncertainty. And that you can be the calm in their storm at the moment. So, Do you want to mention anything about flattening the curve for us, about social distancing?
Yes. So the reason why social distancing is so important, yes, is that we have to flatten the curve, like everybody says. So what that means is our health system cannot cope with, yes, the death rate is maybe 3.5% at the moment, which is very low. But in South Africa, that means it's more than 1 million people, and we cannot accommodate that many sick people in our hospitals. Whereas if we can spread out the infection over a longer amount of time, and the only way we can do that is to meet less people. They say if you restrict yourself to about 50% of your social contacts, it can already flatten the curve. So please be mindful of who you meet, where you meet them, and when you meet them, and avoid public spaces.
Yeah, I think that's very important. Nické, how far pregnant are you at the moment?
36 weeks, we're almost there.
Yes, exciting times, yeah. So do you mind telling us a bit more about the latest information with the risk of coronavirus transmission to your baby? And maybe, is there a risk of transmission in breast milk, breastfeeding? What are you going to do? And then we can quickly chat about coronavirus and kids.
Okay. So yes, COVID-19 is unfortunately such a brand new virus that we don't have a lot to go on. And the latest research is from experience in the cases that happened in the last 2 months in China or the US or Italy. But it looks encouraging at this stage. It looks like pregnant moms and babies and children are not that badly affected. which is great because usually with flu, we are the ones most at risk.
Exactly. Yeah.
So they don't know why yet, but it looks promising. There has not been many moms that are pregnant that get very ill, and the studies have proven thus far that if you do get the coronavirus during your third trimester of pregnancy, it's not transmitted directly to your baby in utero. So you cannot infect your baby while it's still inside of you. They're not sure if you get it earlier in pregnancy, what's going to happen. Yeah, so that we will still have to wait and see. But it looks like this stage, as the risks are more the fever, and if you get very ill and you get low oxygen in your blood count, that can affect your baby just like with any other flu. It also doesn't look like you need to change your delivery plan. So there's no proof that a cesarean section protects your baby more against the virus than a normal delivery. So please stick with your plan and discuss it with your gynecologist. And then also the studies have proven there's no sign of the virus in breast milk, which is great.
Fantastic.
So you cannot give it to your baby via your breast milk. And the only risk is that while you are feeding your baby, that you are in very close contact with your baby. So please practice good hygiene principles, wash your hands with soap and water, and if you are ill or coughing, please wear a mask to try and prevent the spread. You might even decide to only express milk and let somebody else feed your baby. But that is very difficult and also hard for bonding then. So discuss the risks and benefits with your doctor and with your husband, and then make your decision. Newborns luckily also doesn't look like they're too badly.
So have they been affected?
There has been about 3 cases in the UK now that has tested positive from moms that they knew were positive. And they said they tested positive a few hours after birth, but it still doesn't look like the transmission happened in utero. So they think the baby was infected shortly after birth. But the babies were not that severely ill.
That's good news.
Yes, so no need to panic. And then the best you can do for your newborn is social distancing. Keep them away from other people. And that's a bit sad for me because it's always nice to introduce your baby to new people, but in general, wait a month or 2 and then we'll see where we are with this whole coronavirus. Yes, and then in children, it also looks like they are not so badly affected. About 6% of children that are infected might get more severely ill, mostly respiratory disease and shortness of breath, and it looks like they almost always have a secondary bacterial infection, which makes them more ill. There's a new study that was released in this week of about 2,000 kids that they did in China, and they still can't say why the children don't get so ill, but they say that it looks like the infection rate in children is about the same as in adults, and that just means that they are carriers, they are vectors for spreading this disease because they are asymptomatic mostly, and you let them go wherever because they're not ill, but they're still spreading the disease.
And I think that is why it's such a good idea that the schools are closed at the moment to just try and prevent the spread.
Yes, and remember to be careful to ask granny and grandpa to babysit. I know it's tough times with your kids at home for so long, but remember that they are the most vulnerable at this stage of the virus.
Yeah, that's true. Thank you so much. Thanks for researching that for us. I think that was really very informative. And thank you guys for joining us for this video, and we really hope that we will be making more of these shortly. So send us a message if you enjoyed this and found this informative. We would like to know your thoughts. And stay safe in this time, and God bless you.
Bye.
Bye.